Hey everyone, welcome back to the FU Cancer podcast. Our topic for today is integrative oncology. Integrative oncology is a patient-centered, evidence-based field of cancer care that combines conventional medical treatment such as chemotherapy, radiation, and surgery with complementary therapies like nutrition, acupuncture, mindfulness, and exercise, really intended to improve quality of life, manage those side effects, and then support overall well-being. It really focuses on treating the whole person, mind, body, and spirit, while ensuring that all approaches are safe, effective, and scientifically validated. Joining me today is registered dietitian nutritionist Laura Kerns. Laura specializes in oncology nutrition and demonstrates a passion for both clinical care and public education. She's dedicated to improving the lives of cancer patients through evidence-based, compassionate nutritional guidance. She holds a master's degree in public health from the University of Michigan and completed her dietetic internship at Tulane. She is licensed in multiple states and holds advanced certifications in oncology nutrition. Over her career, Laura has worked across hospitals, cancer centers, and private practice, offering personalized care to those navigating cancer care and beyond. From 2020 to 2025, she also helped build a successive integrative oncology practice in Louisiana, later expanding her focus to include weight management, diabetes, women's health, and gut health. As an engaging public speaker, Laura presents regularly at conferences, health events, and on podcasts such as this one, making complex nutrition topics more approachable for all audiences. And of course, outside of her work life, she enjoys gardening, travel, and spending time with her two young boys. Thanks for listening to the FU Cancer Podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. Boys. So Laura, thank you so much for joining us today at FU Cancer.
Thank you so much for having me. I'm happy to be here.
So Laura, how can nutrition in particular help manage treatment side effects like nausea, fatigue, and loss of appetite?
So one of the things I'm always looking at is, what's the root cause of the problem, right? So it can be so easy to say, oh, I'm nauseated, or, a doctor comes and says, hey, this patient's nauseated, I need some ideas. And it's like, okay, well, let's get to, the root cause. Why is someone fatigued? Why are they losing their appetite? So that's kind of where I start, is let's look for the root cause. With something like nausea, a lot of times, it's specific treatment related, but it might be that it's just traditional nausea. It could be that something's happening with their gut that's a little bit more complicated. They could have, constipation that's contributing. There could be a lot of other things going on. So I always want to check out what's going on with the gut. Are they having regular bowel movements, that kind of thing. And then taking things like ginger, or making smoothies with ginger. Ginger is a great way to help the GI tract empty faster. And so it doesn't hold the food in the stomach as long. And so that can help a lot with nausea. Small, frequent meals. So one of the things I think people are always surprised by when I tell them is that if you actually don't eat, you can make your nausea worse. And I think that's always surprising for a lot of people. It's like, yeah, if that stomach's completely empty and that acid is just sitting there, you might actually be more nauseated, right? So even if I can get you to just have a little half cup of food, that's going to be better than nothing, right? Bland foods. And then I've had a lot of people tell me that very cold foods help, or really cold drinks. So, making the water really nice and icy, having a smoothie, those kind of things, they find that that very cold food helps as well. Um, and then for something like fatigue, same thing. Maybe we got to get to that root cause. Maybe somebody's not eating enough, right? So food is energy. And if we're not getting enough food, if we're not getting enough calories, if we're not getting enough protein, that might be why somebody's fatigued. Could be that it's just been a lot of deconditioning from surgery and chemotherapy and maybe some inactivity. And then food's going to need to be paired with exercise. So the bringing in, PT, and we'll talk later more about this, but like Tai Chi and yoga and movement, pieces is going to be huge, not just the food. And then might be supplements. You might need just something as simple as a multivitamin. If you've gone a long period of time not getting enough calories and not getting enough nutrition, it's really interesting. I was shocked the first time someone told me drinking a protein shake that had a multivitamin in it made them feel so much better. That combination of protein and multivitamin. And then for others, it was just adding on the multivitamin. It was like, oh, all these deficiencies are now getting corrected and I'm feeling better and more energetic. So, like I said, getting to that root cause for me is a big thing. Loss of appetite could be fatigue related, could be constipation again, and GI issues that might be contributing. And then maybe we need an actual appetite stimulant. So talking to the physician about, what are some options that actually help stimulate the appetite once all the more natural approaches have not worked. And working with, if you are fortunate enough to have that integrative team, you can add in again the movement pieces to try to help things move through faster for the person, get them more active. That can help. And then even sometimes, again, more supplements like an anti-inflammatory supplement like fish oil can sometimes help if that's a safe option for your particular treatment. So there's a lot of great options, but finding out why we're experiencing the symptom is definitely important.
So something we hear at times when we say complementary therapy are things like acupuncture and meditation. So
Mm-hmm.
do these tactics really help reduce stress and improve well-being? And are there anything else that we should also be thinking about in those areas?
Oh, wow, yeah. So there's a lot of options. And, I'm excited to see, in oncology across the country, more and more programs are adding on these therapies. Because I think it's something even, people who are going through cancer treatment are seeking this out now. It's like there's more to it than just coming and getting treatment and going home, right? I can feel better. There's more that I can do to, thrive during my journey. There's more things I can do to help control symptoms, etc. So, where I was working, we had yoga, Tai Chi, art therapy, music therapy, acupuncture, physical therapy, and meditation, along with nutrition, and of course, our conventional medicine. So, a lot of options, because, for one method might work better for somebody than another. Some New Orleans is a huge music city, right? And a huge art city. So people were very interested in art and music therapy as a way to express themselves, to help with stress and anxiety, things like that. That was a great outlet for them. And there's even some things showing that something like music therapy can even help control pain better for some people. And so these are great, like, non-invasive, very enjoyable options for a lot of people. And then something like acupuncture has a lot of great options. It can help with GI motility. So that was something I would talk to patients a lot about. Like, here's all the things I can help you with your gut. And then maybe we should consider adding an acupuncture so that you're having more regular bowel movements. Same thing, nausea. Acupuncture is great for nausea. There's even the option to get ear seeds placed, on specific pressure points that you can use. Helps with preventing neuropathy from chemotherapy. It can help a lot with pain. Just a ton of different uses. But then there's also, unfortunately, if somebody's platelet counts are too low, they can't do the needles at least. And so there are contraindications, to be aware of. They don't needle close to tumor sites either, or radiation sites. So you definitely want to, work with somebody who is trained specifically in oncology and knows what to be looking for. And then we have all those movement practices, so yoga and Tai Chi, and then we have our physical therapy and occupational therapy, right? And so those can help with things like fatigue and sleep, increasing lean body mass, quality of life. There's a lot more, and I'm sure all of those practitioners can speak much better to it than I could. But yes, and depending what your needs are, there's so many wonderful complementary options.
What's your approach or your recommendations for an individual who's looking to boost their immune system during chemo or radiation therapy?
That's a great question. So obviously I get a lot of questions about, supplements. Oh, should I be taking vitamin C, or, what can I do to, make my immune system stronger because this chemotherapy is knocking out my immune system, right? So I talk to them a lot about, first of all, we just need to nourish our body with a lot of fruits and vegetables. That's where our, natural immunity is going to be coming from. That's where those antioxidants are. And the other big thing is you get those phytonutrients from plants that you can't get, anywhere else in your diet. And then a lot of high fiber foods, which is going to support a healthy gut microbiome. And I know the gut microbiome is all the rage right now. Everybody asks about it. Everybody wants to talk about their guts and how to make their gut healthier. And fiber is, a huge key for that. And as I'm sure you know, the newer treatments, the immunotherapies, that are being utilized, just, I don't know, maybe 10 years, I want to say, that immunotherapy really came out, and now it's just taken off, which is awesome. It's another great option for cancer treatment. But what to me as a dietitian is very exciting is with the onset of immunotherapy is the studies that have come along with it actually showing the impact of nutrition and how someone responds to immunotherapy. So following a Mediterranean style diet is something that's showing improved responses. And so that's something really awesome. And we think it's because of that support for the gut microbiome that the, high fiber foods, and then also, getting rid of processed foods, and reducing inflammation with those, healthy fats, and again, those plant-based foods. So for me, that's a really exciting area. I've been saying it forever, even with chemotherapy, that it makes a difference. Mm-hmm. But at least now, with immunotherapy, it's getting looked at more closely, it's getting studied, and now we actually are getting some really strong evidence behind it, which is very exciting.
Mm-hmm. Well, we know that cancer patients oftentimes have caregivers or loved ones who want to help, right? And we actually just recorded another podcast episode talking about setting healthy boundaries and how individuals can, engage with loved ones without being overwhelmed. But from your perspective, if there's a caregiver who's looking to help and their loved one is experiencing taste changes, food preference changes, like nausea, like you mentioned earlier, what can they do to help support that person to overcome those challenges and stay healthy?
Yeah, a lot of my patients over time have joked that I've been like the intermediary, right? So I always say there's a lot of food fights and a lot of food fears that come into play, like with family members and everything, anyone who's involved in the care and caregiving. I think one of the most frustrating things for a caregiver is when they can't find something that the patient can eat, or, can't, they feel like they're failing them somehow, right? Like, they need to eat, they need to be strong, they need to be able to do these things. And yes, absolutely. But then it kind of becomes this point of contention, between the family members, right? And then there might be some food fears, like, well, you shouldn't eat this particular food, even though that's the only thing that tastes good to you, right? Or, different beliefs about how different foods might affect a tumor or somebody's overall diagnosis, right? And so I think working with a dietitian is one of the best things you can do. So again, like they can be that intermediary, answer any questions you have about foods maybe you're fearful of offering or using, and then helping come up with some strategies to work around the taste changes and the nausea, right? Whether it's, oh, this is the one food that tastes good to you. Well, how can we use that in more recipes, right? And how can we incorporate it into more dishes so that it tastes better to you? Or maybe like, orange juice is the only thing that tastes good to somebody, right? Like, does that mean other citrus flavors would taste good? And can we make like a fruit salad and put lemon in it, or even orange in it to make it taste nice? Or use it as a marinade or something like that, to make your food taste better. Can we, make smoothies and put those ingredients in? So I think there's a lot of ways to work around like those few little, pearls that we're given, that this is the one food that tastes good, or this is the one category of foods that taste good, and come up with more strategies to use those to get a better balance of nutrition. And then I usually, talk to people about, I'm sure you've heard this, and a lot of people tell us this, this sounded really good. And then by the time we fixed it, or by the time we went and got it and brought it home, it didn't sound good anymore, right? Or I couldn't eat it. That's okay, freeze it, put it in a nice little container, put it in the freezer. Next time you feel like it, it's right there. If you want it, great, it's okay. And maybe have a few different options like ready stocked in the freezer. So it's right there, it's available. You have it when you need it. Um, and I've also found, maybe things that don't require a whole lot of chewing. That might sound silly, but I hear a lot about like I put the food in my mouth and then I can't swallow it, or like I start chewing it and it doesn't taste good anymore.
I've heard that
Um,
too, where people say it as I'm chewing it, it feels like it's growing in my
yes,
mouth
in
and
my
it's just
mouth.
becoming too
Yes,
much and they want to spit it out.
yes, yes. That's exactly the description. It's so interesting and it's so common too. And I think a lot of people think they're the only one experiencing that. So just normalizing that can help a lot, right? Like, no, this is a very common side effect. We don't fully understand it. Is it some level of nausea? Is it some level of, something else going on? But finding softer things, and maybe I do a lot of very like nutrient dense soups with people, and I'm like, if you can chew it, great, because it's softer, it's quicker to eat. Otherwise, you can puree it. There's different things you can do with soups that will get a lot of nutrients, but it doesn't require all that chewing.
Mhm.
And then like protein sources, maybe a baked piece of fish that's flaky and soft is easier to eat than like that steak or that chicken because you're chewing it a lot. And yeah, and like you said, it feels like it's growing. So working around, all of those things is big. And I think that can support the caregivers so they have a better idea to know like what to do and why these things are happening. And that it's not just their loved one being stubborn or being picky or just not wanting to eat, right?
Yeah, we're not trying to be difficult. It's just every day may bring something new and different, and we have to learn how to
Yeah,
manage it.
absolutely. Yep.
Well, Laura, I just got one more question for you, and I do think it's a really important one. So, for an individual who is thinking about integrating some of these therapies into their treatment regimen, what questions should they ask their oncologist, right? Because we know it's so important to talk to your oncologist and keep them informed on these things as you're integrating different activities or thinking about it.
Sure. Yeah, I think the first thing is explaining why. Tell your oncologist what's not working for you. Maybe despite being on a very consistent medication regimen for your nausea, it's not doing the trick, right? Or the side effects from those medications are making things worse for you, right? Or something that's going on in your specific treatment just doesn't seem to be well controlled, and you think that this might be helpful. Or maybe it's just anxiety from treatment, which is common and perfectly normal and understandable, right? And so not everyone wants to take another medication to control that. And so if you can do things like meditation and yoga and tai chi, even acupuncture, to control some of those symptoms and help you feel better, then I think that's a great option, right? But I think talking to the oncologist about why you want to pursue these is important. And then, some of them, like I said, you really want to seek out people who have worked in oncology and know about cancer and cancer treatment and, contraindications of any of the therapies. But with things like supplements, right, you need to talk to your dietitian or oncologist and hope and look for somebody who's willing to have an open and honest conversation and not just say no, right? Oh, no, you can't take anything, because that's not true. There are things you can take. So explaining what it is you want to take and why, again, can help a lot. Um, and then, yeah, I think just being able to be open and honest about it. And I think that most people are pretty surprised at how willing their oncologist is to support them in that space. Especially if you are just saying, look, I want to keep taking my treatment, I want to do this, but I want to feel better. that's a great approach.
Well, and we know that healthcare practitioners, physicians in particular, are very data driven. And as you said earlier, the data is coming out and becoming stronger and stronger on some of these therapies. So I think now's a really great time to start those conversations if it's appropriate and something that somebody wants to incorporate into their treatment plan.
Yeah, absolutely. And that's a great point, that, practitioners, we're all data driven, right? We were even trained to be very data driven. And so, there's groups like the Society for Integrative Oncology, for instance, SIO, that is huge and, puts out a lot of great recommendations. And so you can even find, similar to like what you can find for nutrition, where levels of evidence for different practices and recommendations, same thing. You can find that for things like yoga and for acupuncture. And what's the level of evidence and what can it help with, right? So that's a great point as well.
Awesome. Well, Laura, thank you so much for sharing your expertise. You have such an interesting niche and perspective on cancer care. So really appreciate you joining us today.
Thank you so much. It was really fun. It was great to be here.
And listeners, if you like this episode, feel free to share it with your friends and family, your loved ones. And we have a lot of more great content coming soon on Spotify and YouTube. And of course, check out our website at fucancer.health. Until next time, I'm Christina Rollins. Thanks for listening.